Hello friends, I am Dr. Anshula Kayal Bansal. I am a consultant pediatric pulmonology, and in this video I am going to demonstrate to you how to use an inhaler. So once your child is started on an inhaler for asthma or wheezing, you expect to see some improvement in your child's condition. But one of the commonest reasons for poor response to treatment is incorrect use of an inhaler. So this is an inhaler which your doctor may refer to as a PMDI or a pressurized meter dose inhaler. It is called pressurized because the medicine is stored in this canister under pressure. It is metered dose because every time you puff the inhaler, a fixed amount of dose is going to come out. So if you have an inhaler of 100 microgram, each puff will release 100 microgram of the dose. The medicine is brought out of the inhaler with the help of another substance called a propellant. So it is very important to shake the inhaler well so as to mix the medicine and the propellant together. If your inhaler is new or it has not been used for a week, you must release 2 puffs into the air so that the initial amount where the medicine is not there gets removed. You don't have to do this every day, only when the inhaler is new. The next step is to attach the inhaler to a plastic container called a spacer. Now the spacer basically creates a space between the inhaler and the mouth. So on one end we attach this inhaler and the other end goes into the mouth, and there is a one-way valve near the mouthpiece which allows the medicine to go into the mouth but does not allow it to go backwards. So why do we use a spacer? When we puff an inhaler, the medicine comes out in the form of particles. Some of the particles will get deposited in the mouth and the throat, and some of the particles will go into the lungs. Our aim is to ensure maximum delivery of the particles into the lungs. This is where the spacer comes in. It helps in allowing most of the drug to go into the lungs, and it lessens the deposition into the mouth and the throat. And it also improves the hand-mouth coordination so that the entire process of using the inhaler becomes easier. So the first step is to shake the inhaler well. The second step is to attach the inhaler to the spacer. The third step is to release the medicine by an actuation to put the spacer in the mouth, creating a proper seal around the spacer with your lips. And then the child has to take 8 to 10 deep, slow breaths so that the medicine goes into the lungs like this. And when the child is breathing, you should be able to hear the clicking sound of the valve opening and closing. If 2 puffs have been recommended, again you have to remove the puff, shake it well, and then repeat the same steps as before. This is how the 2 puffs have to be taken. If the child is older and he can do a breath hold, it is advisable to inhale the medicine and hold for up to a count of 10 seconds. That ensures better delivery into the lungs. For smaller babies who cannot make a seal around the mouthpiece, we use a mask in front of the spacer. The mask has to be placed around the nose and the mouth of the baby. The rest of the process is same. The inhaler has to be shaken, has to be attached to the spacer, has to be puffed, and the mask has to be attached to the mouth and the nose of the baby, and the baby has to breathe normally for about 30 seconds for the drug to be delivered. The common mistakes that people do are not shaking the inhaler well, not taking slow deep breaths but taking rapid shallow breaths. So some kids take breaths like this. So these breaths are not effective. Slow and deep breaths have to be taken. The third mistake is not creating a proper seal with the lips around the mouthpiece. So if a proper seal is not created, the valve will not open and close, so you will not hear the clicking sound. So it is important to hear the clicking sound. And the fourth mistake is not shaking the puff again in between the 2 puffs. So the inhaler has to be taken out, shaken well again, and then the steps have to be repeated. Now how to clean this spacer? This has to be cleaned once a week in normal water, this doesn't have to be boiled. So you can dip it in water with mild detergent or wash it under running water and leave it in the air to air dry. Do not wipe it with a cloth or do not scrub it, otherwise the surface becomes irregular and the medicine will get deposited inside the surface. I hope this video was useful. Thank you.